Hello, everyone. So episode 86 of Parallax is with my dear friend and colleague, Dr. Nijjer. Sukh has been a regular feature with us at Parallax. He has graciously agreed to round up the prior years, talking about important trials which were presented at the various meetings nationally as well as internationally in cardiology. And he's back again in episode 86, rounding up 2022 for us. And we begin the discussion with ACC 2022, talking about the FLAVOR trial, which compared coronary physiology with coronary anatomy. And who better than Sukh to talk about coronary physiology? So the trial compared FFR with IVUS in non-left main lesions and discusses clinical outcomes. So that's the first trial that we discuss. Moving along to ESC 2022, a highly anticipated and discussed trial, Revived BCIS2, which basically studied the question on percutaneous revascularization in patients with ischemic left ventricular systolic dysfunction. So Sukh and I talk about the nuances of that trial, patient selection, and what were the differences in outcomes in patients who received percutaneous revascularization in comparison with guideline-directed medical therapy alone. Moving on to TCT 2022, yet again, a heavily anticipated and debated trial, Protected TAVR, particularly for its secondary outcome, as well as its primary outcome. And the trial was studying cerebral embolic protection in patients with transcatheter aortic valve replacement. And then we finally round up that discussion with a really interesting study that Sukh did that I wasn't aware of actually, because I don't think the paper's been published yet, but it was presented at AHA 2022. And it discusses a traditional Chinese medication and its role in patients with ST elevation myocardial infarction in comparison with what is standard of care practice. So do tune in to listen to episode 86 with Sukh and I, and please share your feedback on Apple Podcasts, SoundCloud, and Spotify. Thank you.